The metabolic diet aims to help you lose weight and achieve optimal health, and it's been used by doctors over the past decades, even as a part of a natural cancer treatment plan. In today's video, I'll explain to you what the metabolic diet is and how you can apply it for your benefit. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlanevar.com. In this channel, as a conventional doctor, I treat my patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to receive notifications and be the first one to watch a new video. If you need an online appointment or quality supplements for your disease, visit drlanevar.com. I encourage you to stay till the end of this video where I'm going to reveal tips and tricks related to this topic. A lot of people are worried about losing weight and frequently practice extreme diets that sometimes are counterproductive. New diets come and go all the time. The Ornish Diet, the Atkins Diet, the Keto Diet. 3 decades ago, it was the Ornish Diet, the all-vegetable diet, the era of vegans, and extreme weight loss due to low proteins, low carb consumption. And don't get me wrong, many people would really lose weight and feel great physically doing an Ornish diet. But others would feel terrible. They would feel sick with no energy, and some didn't even lose a pound of weight. A couple decades later, we have the Atkins Diet, the era of protein, where you weren't allowed to be eating anything but meat, high protein, low carb diet. And again, many people felt great physically, full of energy, and were losing weight. But others felt terrible. They had no energy, they had constipation, and felt sick with the diet. So now, what do? You try one diet and it doesn't work for you, and then you try another diet, and again it doesn't work for you. Why? What is wrong with you? Okay, and the answer is nothing. Nothing is wrong with you. The thing is that we are all different, okay? We can't expect everyone to be the same, fit in the same category, have the same diet. Everyone is different. Our bodies are different. Our metabolisms work at different rates. We have different hormonal imbalances, different health conditions. We all have different energy demands, and we're all different, okay? And let me give you an example that will clarify this idea for you. Let's talk about the Eskimos, for example, for a little bit, to understand better the concept that I'm trying to pull forward here. Eskimos live in the Arctic, and for thousands of years have fed on a diet that's nothing but fat and meat. 80% fat actually, and about 20% meat. But why, you would ask? Well, because vegetables don't grow in the Arctic, fruits don't grow in the Arctic, they don't even have cereals to feed on. And what can we see from their health? Well, for one, they have average lifespans of about 75 years old, which is about the same as it is in countries that eat more varied, foods and diets. They have less incidence of diabetes, heart disease, and depression. They have good health. And you might ask yourself, but why? They eat an awful amount of fat. Shouldn't they be all sick? And no, not at all. Why would they? You see, they have adapted to their diet for thousands of years, feeding off fish and whale and fat in order to survive in that harsh environment of minus 40 degrees Celsius. Okay, so what would happen if I came up to them and said, my dear friends, all you Eskimos, you need to go on a vegetarian diet in order to achieve optimal health and live longer? What would happen? I would probably kill them. They need fat to survive because they live in extremely harsh climates, and changing their diet would be a huge, huge mistake. I guarantee you they would quickly fall sick and could not possibly survive on a diet like that. You want another example? Okay, the Tasmani people in South America. Okay, the Tasmani live in the Amazon, and according to the University of New Mexico, have the world's healthiest arteries in the planet. They have the lowest prevalence of coronary arteriosclerosis in the world. What do they eat? Well, their diet is low in fat, high in protein and carbs, and their average lifespan is about 75 years of age. So what's the secret? The Eskimos eat a high-fat, low-vegetable, low-protein diet, but the Tsimane people in South America, low-fat and high-carb diet. And both these tribes have excellent lifespans and great health. Where does the secret lie? What's the difference? And the answer lies in that we have different body requirements that have adapted over hundreds of years, and we are all unique. So instead of using a diet that could be harming your health, we should be looking for a diet that fits us best. and based on that, lose weight and achieve health. The metabolic diet was created to do exactly this. The metabolic diet was accidentally discovered by a dentist, Dr. William Donald Kelly, who was diagnosed with pancreatic cancer in the 60s, and in an attempt to discover a cure to the cancer, ended up discovering the use of every single mineral and vitamin in the body. Incredibly, he experimented with every mineral and vitamin and food and discovered that each and every food has a specific effect on our metabolism. Pancreatic cancer is one of the deadliest cancers in the world, which normally may last about 3 months before the patient passes away from it. Okay? And Dr. Kelly in this time frame was experimented with each food and discovered its effect on health and his metabolism, ultimately curing himself from cancer. The metabolic diet 60 years later is precious, used by many to lose weight, cure diseases, and achieve optimal health. So join me in the next few videos where I will guide you through the metabolic diet and how you can achieve optimal health with weight loss based on your specific needs. Help out the channel by giving this video a thumbs up and sharing it with your friends and family. And if you have any questions or comments, feel free to leave them down below and I'll be happy to assist you. If you need quality supplements for your disease or an online appointment, visit drlandivar.com. Thanks for watching, you guys, and I'll see you soon.